If you have obstructive sleep apnea, the muscles of your mouth and pharynx may relax too much. Your tongue drops onto the soft tissue in the roof of your mouth, pressing it against the back of your throat. This completely blocks the flow of air into your lungs. The lack of oxygen in your lungs wakes you up. You may gasp for air to reestablish airflow before falling asleep again. The cycle of apnea and waking up may happen many times at night, preventing restful sleep. Common symptoms of obstructive sleep apnea are snoring, morning headaches, chronic daytime sleepiness, fatigue, irritability, and impaired concentration.